So, good day everyone. My name is Al-sodaire, a nursing student from Notre Dame of Tacloban College. So today I'm going to demonstrate the bag technique. So the definition of the bag technique, it is a tool making use of public health bag through which the nurse, during his or her home visit, can perform nursing procedures with ease, less time and effort, and renders effective nursing care. So our purpose is to render effective nursing care to clients and or members of the family during home visit. So our content of the bag and its arrangement. So from the front of the bag, left to right is the oral thermometer, rectal thermometer. On the right near end of the bag is the test tube and holder, medicine dropper. On the left near end of the bag is the medicine glass, weighing scale, bandage scissors. From the back of the bag is the alcohol with 70% acetic acid, aromatic spirit of ammonia, Benedict solution, and the betadine. From the center of the bag is the forceps, roll bandage, alcohol lamp with denatured alcohol, kidney basin, and on the top file center of the bag is the hand towel, soap on a soap dish, paper waste bag in pocket of the bag. The ophthalmic ointment, also the hydrogen peroxide, Zephyrin solution, spirit of ammonia, acetic solution, syringe and needles in container, tape measure, cotton applicator, cord lamp, rubber gloves, newspaper to serve as lining apron, and the plastic bag. So note, if the blood pressure apparatus and the stethoscope are carried separately, package containing a sterile drape, sterile equipment as needed, wrap sterile gauze, antiseptic solution. So our first procedure is, upon arriving at the client's home, place the bag on the table or any flat surface, lined with paper lining, clean side out, folded part touching the table, put the bag's handle or strap beneath the bag. So the rationale is to prevent the spread of microorganisms. So for our next procedure is, ask for a basin of water and a glass of water if the faucet is not available. Place this outside of the working area. So rationale is to prepare for hand washing. Next procedure is open the bag and take the linen or the plastic linen and spread over work field or area, so the clean side out or the folded part out. So rationale is to prevent the spread of microorganisms. So for our next procedure is take out the hand towel, soap dish and apron, and place them at one corner of the work area. So within the confines, linen plastic line. And the rationale is to prevent spread of microorganisms. Next procedure is do hand washing, wipe, dry with towel, leave the plastic wrappers of the towel in the soap dish in a bag. So the rationale is to prevent the spread of microorganisms. So for our Next procedure is put on the apron right side out and wrong side with first touching the body. So sliding into the next strap, neatly tie the straps at the back. So rationale is to prevent the spread of microorganisms. So for the next procedure is put out things most needed for the specific case and place at one corner of the work area. So rationale is to prepare for the next action. Next procedure is place waste paper bag outside of work area. Rationale is to prevent the spread of microorganism and also close the bag. Rationale is to prevent the spread of microorganism and proceed into the specific nursing care or treatment. So for urine test for albumin, first is cleanse and assembles all articles, equipments needed. Second is prepare 3 or more cotton balls with denatured alcohol or alcohol lamp. Third is fills the test tube 2 to 3 of urine. So note, urine specimen should have been collected early in the morning before breakfast. 4 heats the upper portion only of the test tube with urine without shaking. So compares the heated to the unheated portion of changes. Next is read and interprets the results correctly. So if there is no change on the heated portion, the result is negative. The acetic acid is not added. If cloudiness appears, B1 add 5 drops of acetic acid to the urine. So heats again to rule out presence of phosphates. Note, if the cloudiness disappears, the result will still negative. But if it persists despite of addition of acetic acid or even deepens, the result is positive. And discard the things appropriately, explains correctly and comprehensively to the client or caregiver the result and interpretation of the test. For urine test for sugar, measure the 5 ml Benedict solution in medicine glass, holding the test tube with the holder. Heat it over a spirit lamp till the Benedict solution boils without overflowing. And drop the 8 to 10 drops of urine into the boiling Benedict solution. After again boiling the mixture, let it cool down. While cooling the mixtures, it changes color. So the color of the mixture serves as a guide to the amount of sugar in the urine. and read and interprets the result. So for a blue sugar, absent, green to 0.5% sugar. For the yellow, it has 1% sugar. Orange is the 1.5 sugar. From the bright red, it has 2% sugar. So discard things used appropriately and explain correctly and comprehensively to the client or caregiver the result and interpretation of the test. And after completing nursing care or treatment, clean and alcoholize the things we use. And also do hand washing again. And open the bag, put back all the articles in their places, remove the apron, folding away from the body with soiled side folded inwards and inside out, place it in the bag. Our next procedure is fold the linen or the plastic lining clean. So place it in the bag and close the bag. And make EPO's visit conference on matters relevant to healthcare, taking anecdotal preparatory to final reporting. So, next procedure is make appointment for the next visit, either home or clinic, taking note of the purpose. So, cease to eat that the waste receptacle and its content are properly disposed of before leaving home. And also maintains body mechanics throughout the procedure, manifest neatness on the performed procedure, and also provides and ensure patient privacy throughout the procedure, and observes courtesy, shows calmness while performing the procedure, and also depicts the mystery of the procedure and uses correct grammar and syntax. So that's all for the bag technique. Thank you.